There are now more than 1,000 cases in 38 states and Washington, D.C. Among the latest, 3 TSA workers at a California airport tested positive.
In the meantime, a mile-wide containment zone will be created around a large cluster of cases, the largest cluster in the country. It's happening in the New York City suburb of New Rochelle. The National Guard has been called in.
Drastic steps could also be taken in the Seattle area today, where a ban of crowds of 250 people or more, that's expected to be announced.
The outbreak is also impacting the presidential race. Joe Biden and Bernie Sanders canceled their overnight rallies in Ohio. Their next debate, which is for later this week, will not have an audience. By the way, we're going to get to the primaries results from yesterday just ahead, but we have a lot to cover on this coronavirus story, including our live interview with New York's Governor Andrew Cuomo. That's coming up soon, but we'll begin our in-depth coverage with NBC's Tom Costello. He's in Baltimore, inside the Incident Command Center at Johns Hopkins Hospital. Tom, good morning to you.
Yeah, good morning, Savannah. So they are right here coordinating how the entire system within Johns Hopkins, the entire medical system, responds to the coronavirus outbreak. Do they have enough staff on hand, enough equipment, enough protective equipment for all of their personnel? What happens if somebody who's on staff, a nurse or a doctor, comes down with the virus? How do they help isolate that person, backfill that position, care for all the patients? That's what they're involved in here around the clock. Meanwhile, up on the wall, this is really the definitive word that the entire world is using, the Johns Hopkins global case-by-case counter. And as you mentioned, 1,000 known cases in the United States right now. Known cases. Importantly, experts believe there are far more than 1,000 cases right now. The vast majority of people who have been sick simply haven't presented to a health clinic or haven't been tested. Meanwhile, New York taking a major step towards stopping the spread of the virus. This morning, emergency measures in New York. The state's governor deploying the National Guard to New Rochelle, a suburb of New York City, in an effort to contain a coronavirus outbreak there. Residents within a 1-mile radius are required to stay within the area for a 2-week period.
It is a dramatic action, but it is the largest cluster in the country. And this is literally a matter of life and death.
As new cases spread nationwide, health officials are warning all Americans to be prepared.
You have to start taking seriously what you can do now, that if and when the infections will come, and they will come, sorry to say, sad to say, they will.
Earlier, President Trump appeared to contradict that, downplaying the threat.
We're prepared and we're doing a great job with it, and it will go away.
But in Washington state, where the most deaths have occurred, the governor is warning without action, things could rapidly escalate.
In 7 or 8 weeks, there could be 64,000 people infected in the state of Washington if we don't somehow slow down this epidemic. And the next week it'd be 120,000, and the next week it'd be 250,000.
Meanwhile, in California, passengers are still slowly disembarking the Grand Princess cruise ship, then traveling by plane and by bus to military bases where they'll be held in quarantine for 2 weeks. The process expected to take days. On the campaign trail, Joe Biden and Bernie Sanders both canceled primary night rallies in Ohio. This Sunday, they'll square off in the first debate in the 2020 cycle without an audience. On the education front, a growing number of school districts are closed for several weeks, while many major universities are suspending in-person classes. Harvard among the latest, telling students to pack up their dorms and head home.
I live in California, so I figured out how to get my things in storage.
And just across the river in Boston, all eyes are on the city's world-famous marathon next month. New York City has already called off its half marathon that was supposed to take place Sunday. Ivy League schools have canceled all of their men and women's basketball tournaments. But for now, the NCAA is still planning to allow fans to attend March Madness games. The fear over the disease even hitting the food industry. MGM Resorts temporarily closing buffets at restaurants across Las Vegas. And Ben and Jerry's postponing their popular Free Cone Day for the first time in 40 years. Vice President Pence says that all 50 states now have test kits. And by the end of the week, he says there will be 4 million test kits that are out there. By the way, a biotech conference, a recent conference in Boston, is proving to be the epicenter of the Massachusetts outbreak. They've had 70 cases in Massachusetts linked to that conference. And then people left that conference and they dispersed to other states. So you can see how quickly this has spread just out of a normal, everyday conference. Guys, back to you.
It makes it very clear what officials are trying to prevent now. Tom, thank you very much.
We're going to focus now on that situation right here in New York, a 1-mile containment zone in the suburb of New Rochelle with the National Guard called. And we're going to talk about it with Governor Andrew Cuomo in just a moment. But first, NBC's Morgan Radford is in New Rochelle for us. Hey, Morgan, good morning.
Hoda, good morning. There's a sense of fear and confusion and uncertainty this morning in New Rochelle as people brace for a virtual lockdown because this has now become the epicenter of the coronavirus outbreak. 108 confirmed cases here, and that's more than double the number of cases in New York City and the largest cluster of cases in the entire country. That's why just a few blocks from where I'm standing now, they set up a containment zone, and that's an area of about 1 mile in radius where large-scale meeting places like schools, churches, synagogues, community centers will be shut down for 2 weeks starting tomorrow. And the number of these cases really stems from interaction with one man, a lawyer in his 50s, who became symptomatic last month. And then that virus very quickly spread to his friends, his family members, his colleagues at work, even people who attended his synagogue. That's why the National Guard has been called in here to New Rochelle to really clean those surface areas and schools and to help deliver food to people who are in that quarantine zone as people here in New Rochelle brace for that lockdown starting tomorrow. Hoda?
All right. Morgan Radford. Morgan, thanks.
And let's turn to New York Governor Andrew Cuomo, who joins us live. Governor, good morning. It's good to have you with us.
Good to be with you.
We are talking about this situation in New Rochelle. It sounds very dramatic. It is dramatic, a containment zone. But what does it mean in practice? As I understand it, it's not no one in, no one out, not checkpoints, but the National Guard is there.
Yeah. Good morning, Savannah. Hoda. It sounds more dramatic than it is. Let's look at the situation. We have about 108 cases in New Rochelle. Just to put it in perspective, we have 36 cases in New York City. New York City is 100 times the size of New Rochelle, okay? So New Rochelle is the hottest spot, if you will, in the country, the most dense cluster. And as you hear from all the experts now, we have to take action. We have to do something. This is not going to stop spreading on its own. It never has. Not in China, not in Korea, not in Hong Kong. We are going to determine our fate, and we're going to have to take actions. Our action in New Rochelle is just no large gatherings. People can come, people can go. There's no limitation on movement, but no large gatherings, because the large gatherings are where it spreads. We know that. So if you have a high concentration of people, no large gatherings.
Beyond New Rochelle, and I know that in particular in New Rochelle, you've set up facilities to test for the virus right there. But to the larger issue of testing, this has been a persistent source of concern. Are there enough tests? And is there an ability in the state of New York and more broadly, if you can speak to it, to get the results of those tests to labs and back in a timely manner?
That is the issue. And when they do the retrospective on this one, they're going to say, why did it take the United States so long to bring up the testing capacity? We knew this was happening in November and December. We watched China. China did something like 200,000 tests per day. South Korea did about 15,000 tests per day. The United States has only done about 5,000 tests to date. And the way these other countries have gotten ahead of it was you do the testing, a lot of testing, you identify the positives, you isolate the positives. So the retrospective is going to be there.
But from the prospective, that's just where I'm going, because real quickly before we have to wrap up, what is the situation now? Is it improved?
Well, the federal government, I think, in large measure is now leaving it up to the states. Just take the handcuffs off me and let New York State do what New York State can do. Let the other states take their own path forward. And we're going to ramp up as quickly as possible now that the federal government is giving us some leeway.
All right. Governor Cuomo, I know it's a busy time for you. I appreciate your time with us this morning.